I mean, I think it all comes back to trying to minimize circadian disruption, right? Like we want to try to create as much circadian alignment as possible. So that's eating while the sun is up, biasing a bulk of our calories earlier in the day, finishing our last calorie a couple hours to 3 hours before we intend to sleep, stabilizing when we go to bed and when we wake up, doing that as often as we can, getting a lot of water, really trying to minimize alcohol intake, putting nourishing, nutrient dense food in our body, really important, meeting our sleep need. These are just like kind of the basic stuff, and I would say, working out, getting exercise daily, movement, really, really important. Trying to, pay attention to that sedentary behavior and not let that, creep into the hours and hours over the course of the day. So just like a lot of the typical things.
All right. Kristen Holmes, VP of Sports Performance and Recovery at Whoop. I am just thrilled to welcome you to the show. Welcome.
Thanks for having me. I'm so excited to chat with you today. I've been following you for such a long time and just such a fan of your work and appreciate everything that you do to educate us on all things kind of health and performance. So thank you.
Thank you. I really appreciate that. And I wanted you on the show really because we're going to do a deep dive in recovery. And one of the things that I've observed in myself and also with a lot of the individuals that I've counseled and cared for over many years is that fatigue management, recovery management, let's say, may be the single greatest indicator of whether we're not going to be successful in our progress in terms of whatever our fitness and exercise goals might be. And as we, at least for me, as we move into our 40s, which is where I am now, one of the things that I think about a lot is injury prevention. And this is why recovery becomes so important, because we want to be thinking about progress, but also we also don't want to be taken out by an injury, because an injury in your 40s or 50s, let's say, is markedly different than an injury, let's say, in your 20s or 30s. And even then, the arbitrary timeline that you set for yourself where you're like, I'm going to be better by Saturday. Saturday comes and goes and you're like, what the hell?
Not so much.
Not so much. Yeah, exactly. Yeah. So my observation has been, and this has been my own experience as well, is that recovery is more psychologically difficult than sort of psyching yourself up for like a big workout. And so I thought we might start with what are, maybe defining recovery, why that's so important for any exercise, or even if it's not an exercise goal, even if it's not a personal goal, but why this is relevant for personal and professional goals. And then maybe we can start to parse apart some of the individual components of recovery.
Yeah, I think that's a beautiful place to start, and I actually love starting with definitions because I think that gives us a framework for how to think about our behaviors. And I like to define recovery as our capacity to adapt in a functional way to external stress. And I think like when we really break down, okay, are we actually adapting in a functional way? We can then start to unpack, okay, well, what does functional actually mean to me? And that's where you can really decide, well, who do I want to be in the world? And actually asking some of these bigger questions. If I want to be able to adapt to life stress in a functional way, what is that actually required of me in terms of just my daily behaviors and in terms of how I show up in the world? And so I kind of think about it as, all right, if functional adaptation is a goal, what do I need to have foundationally in order to enable that? So I think from my perspective, so if I back up and think about, okay, what are my values? Like I want to live my values with joy and energy. What are those that I care about? I want to be able to be as present and engaged with my children as I possibly can. I want to be patient and tolerant, and I want to be kind. I want to be able to, share my skills or whatever whatever my skills are. I want to be able to, share those with the world. So how do I kind of back into that? And I think one of the components is be able to kind of functionally adapt to stress, as often as possible. And what that really means is that I have to kind of manage my stress very proactively. So there's a sleep component to that, that basically enables me to adapt to stress in a functional way. There's also a training component to that. Am I training appropriately relative to my my capacity, right? And how am I thinking about that? How I'm monitoring that? So I think that, recovery, it's more than just recovery. I think it's really figuring out, okay, who do I actually want to be in the world, and how do I back into that?
So really, it's a definition of core values, right? First, we want to understand what we stand
Yeah.
for and what we don't. And then what are some of the pillars that sort of stack up? What are some of the bricks that I can lay that's going to
Mm.
allow me to to fully express who I am in whatever capacity that might be?
Yeah, absolutely. And people have different goals and levels, but I think to your earlier point, like if we're injured or sick, it's really hard to live our values. It's really hard to kind of show up in the world in the way that we want to. So I think at a fundamental level, you know, I think I think most folks are really interested in not getting sick and not getting injured, right? as a
Right.
as a path to be able to, live their values, as intentionally as possible for as consistently as possible.
You mentioned managing stress, and I just wanted to double click on this a moment before we sort of get into some of the components of recovery management and fatigue management, because I think this is so important. One of the things that I find, I see this more often, maybe discussed in the online space, as if stress is often discussed like cortisol is the devil, stress is the devil. We want to avoid this at all costs, and certainly overdoing it, as we're going to be talking about, can certainly impact our recovery and our ability to perform the next time that we're doing whatever activity we've set out for ourselves. And I think two truths can be possible at the same time. Stress is actually very important for us to grow. I think that people use the word hormesis. We're starting to see that word used a little bit more, but I do want to reframe the different types of stressors, right? We have eustressors, we have distressors. And I thought maybe you could speak into that a little bit, seeing as though you are the VP of sports performance and sort of knowing a little bit about how stress can
Yeah.
impact our ability to adapt. How can stress be a good thing?
Yeah. I completely agree that I think society has kind of put this uh, weird spin on stress and made it just bad, that we should be inoculating ourselves from stress. And I totally disagree with that. I think it's really about, like, the number one thing is I think framing stress. And I think how we frame it, if we are, I'll use an example of like a stressor that could be good or bad depending on how we frame it. To use cold, for example, cold immersion. If I'm going into a 40-degree cold tub, which for most humans is going to feel really uncomfortable, and their body's going to feel really unsafe in that temperature. But if I go into it saying, okay, this stressor is going to help me, I'm going to release dopamine. It's going to help my immune system. So I basically frame that stressor as positive. That will end up being a hormetic stressor, in that it doesn't kill me, but it's making me stronger. So assuming that you're staying within the parameters of safety and all of that, very important. You're not getting hyperthermia. Like, this is about just like, a couple minutes in this cold tub with the goal of promoting, positive stress. Now, if I were to go into that same situation where I get pushed off a boat into 40-degree water and I'm trying to survive, that's going to be a bad stressor, right? I'm going to perceive that stress as negative. As a result, it's going to manifest negatively in my system and probably not be a positive response or adaptation. So our mindset going into the stress is really important. And I think you bring up such an important point that we need to start to think about stress in our life as an opportunity for growth. And I think it's important to note that I think folks have a different default kind of mindset around stress in general. And that would be something that's worth unpacking at a kind of individual level, is like, all right, how positive and optimistic do I feel about the future? Right. And you can kind of look at Carol Dweck's work on growth mindset, which is great. There's people kind of either go left or right. But you want to try to go, if growth oriented and thinking, positively about the future is to the right, we want to try to get to that as much as possible. So, and that's something that you can kind of train. And Sean Akers' work is absolutely amazing. And it would be worth linking. He was a Harvard professor and done a ton of work around happiness, but really gives a lot of really useful tips and tricks on how to kind of frame the world in a more positive light. And a lot of that is, entry points are awe and gratitude. But kind of that is a pathway to kind of improve our perception of just the world around us and look at the world through a more, positive lens. I think helps us kind of think about stress more as an opportunity for growth as opposed to something that is going to kill us. So that's, I guess, a quick framing of stress.
Wonderfully said. And I think, a lot of us, a lot of people listen to this podcast and others because they want to become stronger and more resilient in some way.
Mm.
And I think that there can be sort of this paradoxical, I want to be stronger, I want to be fitter, I want to be more resilient, either mentally or physically, but avoid the conditions that actually create that strength, right? Like the cold therapy, right? It's like the cold therapy, it's uncomfortable every time I get into my bathtub with that ice that I've dragged in from the gas station. I'm like, this is going to suck. Every time. Totally. And I'm like, do I really need to do it this time? I already did it last time. You have that little, like all these little, but I get in anyway. And afterwards I always feel amazing.
Yeah.
But these are the conditions that actually create some of that grit, right? That cellular grit, whether it's mental grit, physical grit. So I think leaning into the conditions that actually forge strength, right? I think is very important. And some of those things are very stressful.
Yeah. Yeah. You can kind of think about it like I always think about it like a bank account. You're either making a deposit or you're making a withdrawal, and you've got, your bank account is resilience. Like you want to make as many deposits as you can, and it's these little behaviors that really add up over time, that are going to either upgrade your resilience levels, i.e. reduce your, your propensity or chance for injury, or sickness, or not, and nothing is black and white, but I think there are some things that are going to, be without a doubt a deposit and without a doubt a withdrawal. And I think the more, and this is the crux of your work and hopefully my work too, is trying to help people understand, okay, how do I actually apply my effort? If my goal is to reduce injury and reduce sickness and, be as healthy as humanly possible and show up for life in a way that feels good to me, what are these deposits that I need to make every day?
Awesome. Well said. All right, let's dive into some of the components of recovery. I've heard you on your podcast, on the Whoop podcast. We'll shout out to the Whoop podcast. We'll make sure that that's in the show notes as well.
Thank you.
You talk about HRV, and this is something that I love that this is so mainstream now. When I was in clinical practice, I had an HRV machine, and this was part of my intake. It was sort of now there's so many more advanced sort of technologies, but we would make the patient sit there for 5 minutes and like read sort of the inputs, the autonomic inputs and whatnot.
Yep.
But let's talk about what HRV is and why this is such a salient signal, let's say, for how somebody is managing their stress. Yeah.
So I think really what HRV is an amazing proxy for is to understand how you're adapting to stress. So you asked me that definition of recovery. It's how well are we adapting to external stress? And HRV is kind of a measure of how well you're adapting to external stress. So I think that's what makes it really powerful. It's just kind of a nice, daily or weekly check-in on, okay, am I positively adapting, or am I adapting functionally, or am I not actually adapting functionally? And so HRV is an amazing proxy, and just high level heart rate variability is a function of the heart that originates in the autonomic nervous system. And the autonomic nervous system, I think, is really important to understand, because this is where, it's the rest and digest is the parasympathetic, and the sympathetic is the fight or flight side of the branch of the autonomic nervous system. And they're both kind of competing to send signals to your heart. When you are recovered and ready to go, managing energy effectively, your heart's probably going to be responsive to both inputs of the autonomic nervous system. This is going to allow you to respond and adapt to your environment in a really functional way. When your heart rate variability is suppressed, that means your heart is going to be less responsive to these signals. As a result, you are going to adapt in a less functional way to your environment. So imagine those moments where, let's just say, you're underslept, you're maybe overfueled, you're underhydrated, you're probably going to have a really suppressed heart rate variability. As a result, that's probably going to manifest in your life in some sort of probably suboptimal way. That is, you might be less tolerant or, less optimistic. Like you can't turn on that mindset that's going to allow you to kind of look at a situation as an opportunity. And as opposed, as a result, you're kind of seeing it as, it's kind of that glass, is glass half full. Yeah. Instead of half empty. Yeah. Glass half empty as opposed to glass half full. You kind of have that like default, like negative mindset. So, so I think, heart rate variability is just this awesome shot or window into how our behaviors are either laddering up positively and enabling that functional adaptation or not.
And when we talk about ranges, so I'm going to out myself here and say that I have a relatively low HRV. I can modify it. You mentioned a few things that really, like my hydration really does impact my HRV levels. If I've gone to, my husband and I have started going to this sort of Scandinavian spa where you just sort of go into a barrel sauna and then you do cold plunge and you just keep, you continue to alternate. And so a day of that, 4 or 5 hours of that, the next couple of days, my HRV is very, very high, but typically my HRV is very low. So I have a couple of questions for you. Well, I'll say low relative to other people where we're all checking and comparing our HRVs to each other, which is the wrong thing to do for the record. Right?
So there are general population averages. So, generally speaking, so on the Whoop platform for men, so for 25-year-olds, the average HRV is 78. 35-year-olds, it's 60, 45-year-olds, it's 48, and 55-year-olds, it's 44. Just to give you a sense of just, so this is just population data.
Yeah.
So I just gave you all female ranges.
Female ranges. Okay. So I've heard generally you should try to have an HRV that's about your age. But that sort of goes contrary to sort of what your, can you read those numbers for me just again?
I sure can. Yep. So for 25-year-olds, the average HRV for women is 78. For 35-year-old women, it's 60. For 45-year-olds, it's 48. And for 55-year-olds, it's 44.
All right. So your girl here is still coming in under the average. Yeah. But part of it, I know part of it, like part of it is just me being able to process, residue, let's say stressful residue that still resides in my nervous system, which I'm
without a doubt,
actively working on. But there are things that I've noticed that really do help it. So the hot and cold manipulation, how well I've slept, of course, that's a huge one. And then my hydration levels, I do also see big changes there. Do we think that HRV is sort of to some degree genetically determined? Like, are there some people that I'd like to maybe excuse myself for working on my stress here, but are there some people that are just going to have a low HRV no matter what, or I still have a lot of personal work to do? What are we thinking, Kristen?
So HRV is modifiable.
Yeah.
Now it is going to decrease with age. There's no question. I know. Sorry. I can't lift you up the hook. I know. But you have to understand that it is genetic, and women in general are going to have a slightly lower HRV than men. And that's more to do with heart size than anything. But there is a genetic component that gives you kind of your baseline entry point. But that said, like just even what happened, when you're in your mama's belly can impact your kind of baseline heart rate ability. Any early childhood trauma that you might have experienced is going to impact kind of your baseline HRV. So, I know some folks in my life who have been, struggled with alcohol for, decades, and then get sober, come onto the platform, and they have like an 8 HRV, and they're in their 40s. So, it's, your prior behaviors are going to influence kind of your starting, like when you first start measuring heart rate variability, it's a product of kind of everything that's led up to that moment is going to impact. And then really, I think the focus for folks is, can I make just small improvements over time? And I think back to that little bank account, there's going to be behaviors like you mentioned, Dr. Stephanie, like you mentioned, the hot and the cold, and minding your hydration. And there's some other like really important ones that we can talk about too, that are going to put, deposits in the HRV bank account and aren't detracting. But it's like all these little behaviors kind of add up over time and are going to, and should improve your ability to respond and adapt to external stress, which is going to be reflected in that HRV metric.
Okay, great. So let's talk a little bit about that because I'm just looking at these numbers again. I wrote them down when you told me the second time.
Hmm.
So we what we're seeing here at 25, it's 78, 35, it's 60, 45, it's 48, 55, it's 44. We're seeing this sort of stepwise decline in HRV, which signifies to
Yeah.
me that there's less, you might tend to run a bit more sympathetic dominant. Would that be a fair
Hmm.
categorization
That's
there?
that's exactly right. So yeah, and that's where, in your opening kind of monologue, you were talking about just, stress being good or bad, and that's where, you know, if you are not breaking up these moments of stress throughout your day, you end up being, sympathetically, activated. Like your sympathetic branch of your nervous system is chronically activated. That is when you will see deleterious effects on your heart rate variability. So you want to make sure that, again, stress isn't bad, but you want to give yourself appropriate levels of rest that are proportional to that stress as proactively as possible. So oftentimes people go through, 6 weeks of just chronic activation and are like, okay, now I'm going to rest. I go on vacation and I get deathly ill, right? Like that's your body is coming down from that stress. And I think there's a term for this. You might know it's sickness. I see this in my surgeon and military population
I got sick
and
after
professional
every set of
athletes.
exams, like after
Yep.
my board exams, I was sick for
Yeah.
weeks. Yeah. Yeah.
Your body is just mobilizing all the resources to be able to kind of do this thing that you need to do,
Mhm.
and you're just driving. Your heart rate is, kind of chronically elevated, and you kind of get through it and you're like, all right, I did it. And then finally, like you come down and like the dopamine and the adrenaline and the cortisol, the epinephrine, like everything just roll. And that's when your body is like, okay, we don't need to be activated anymore. Now, like, let's deal with all of the fact that I haven't been taking care of myself for 6 weeks. Now let's try to like get ourselves back to homeostasis here. And that's where your
Mhm.
body is basically shuts down, like forces you to shut down so it can kind of, do all of the recovery and regeneration that needs to happen that you've neglected over the last 6 weeks.
Okay, so I also think that looking at these ages, we sort of see the stepwise decline. This is also why recovery actually becomes more and more important as we age for that
Yeah.
fatigue and injury
Proactive
management.
recovery.
Exactly,
Yeah.
exactly. So
Yeah. Yeah.
let's dive into some of the parameters or some of the verticals maybe that can help to
Mm-hmm.
increase HRV. So we're increasing our
Mm-hmm.
balance, if you will, of parasympathetic and sympathetic function. We've sort
Mm-hmm.
of danced around a few of them, cold therapy, but I actually wanted to start with light because I know that this is a really big part of some of the research that you do, and I've heard you speak
Yeah.
so eloquently on it. So how does light, let's say, affect our circadian rhythms? How does it affect our ability to
Yeah.
recover? What does
Yeah.
that look like?
Yeah, light is the most powerful input, in that it really tells our system what it is that it needs to do at different time points during the day. And so basically, we've got this natural light dark cycle, right? So during the day, it's, light out, it's bright out. During the night, it's dark out. And our system, our cells, our tissues, the organs in our body are all basically kind of just imagine they're just feeding off of these cues that we give it. And light is that big one. So it's basically when we see light first thing in the morning, it wakes our system up. It's like, all right, time to go, cells, tissues, and organs. Like we're fired up, we're ready to go, we're ready to tackle the day. We release cortisol. Like there's all sorts of hormonal things happening. Um, if we deprive ourselves of light in the morning, that is, we don't get light, our system doesn't know what to do. And thus begins this kind of, I think, syndrome called circadian misalignment. Now, of course, one day, not a big deal. But if we're chronically missing that bolus of morning light, we will become desynchronized. And your circadian rhythm might adapt, but it doesn't mean that you're performing optimally or that you've adapted in a functional or healthy way. You will adapt to a lower level of functioning. You will increase your risk of disease. You will increase your risk of injury. So that bolus of light in the morning is so important. And at the other end of the spectrum, once the sun goes down, we need to do our very best to restrict our light. We have not adapted to blue light after the sun goes down. And I think that we haven't evolved to adapt to blue light after the sun goes down. And I think that this, modernity makes it so difficult, right? It sabotages us at every corner in terms of our health, right? And I think light is, and just having access to light 24/7 is one of the biggest problems facing human health. I think that we can experience like that we're kind of as a society we're faced with. And people are watching TV, they're engaged on their smartphones and their iPads, and they just get this blue light. And as a result, you don't feel sleepy when you need to feel sleepy. You bypass that melatonin release, or you push past that melatonin release. And once you push past that melatonin release, now all of a sudden your body's like, oh no, I'm not safe anymore. And I need to mobilize resources because I need to fight and I need to flight. So as a result, like you end up, basically infusing your body with stress. And kind of all these chemicals and hormones that are basically telling your body it's time to be awake. So again, the misalignment continues, right? So this concept of circadian alignment or misalignment is can be found in the literature. There's tons and tons of papers. As you mentioned, this is a bulk of my research is kind of in this area of circadian alignment and what behaviors kind of ladder up to alignment versus not. But it's well established in the literature that this alignment is really important. And one of the best ways to create alignment is kind of sync up with the natural light dark cycles as much as humanly possible.
Okay, so I have some questions.
Yes.
I've many questions on this. First, so this summer I was invited to speak at Mind Valley University, and we went to Estonia. Beautiful country. Oh my goodness, the food. I was so delighted to meet the people there. In the summertime, the sun sets at, and my clock did not know this. My circadian clock was not used to this, set at 11 o'clock at night. Like it was bright in the sky until 11, and we had blackout blinds in our hotel, but that sun was up at 3:30 or 4 in the morning.
Yeah.
So when you are, and this is maybe a question more for like the extremes of the earth. I'm thinking about this, individuals in Finland and Sweden and Denmark and Norway, and even in France. When we were in Paris, the sun was still up at 10 at night. I'm Toronto. So I'm in Toronto. So the sun here, in the summertime, it's still light at about 9 o'clock, right? So 9 o'clock, it sort of sets. And then, I'm an East Coast girl, so like New York, Boston, like sort of that whole Eastern corridor, like we're all kind of the same in terms of when the sun. So when I was in Paris, I was shocked that it was still light outside at 10. We were walking home from dinner and it was 10 or 10:30 at night and the sun was still out there.
Yeah.
So when you're talking about circadian alignment, is it that we are trying to align with the sun irrespective of where we are? So if you're someone in Estonia where you have 5 hours essentially where the sun is not around, is that an ideal rhythm to get into because that's the geography, the geographical location that you are in? Or is it, I want to try and get, a certain amount of dark over the course of the day and a certain amount of light?
Yeah, I think this is a question that I don't know that we've arrived at the perfect answer, but I think what we know, I did this huge study with Army Alaska, so looking at a really it's the most extreme kind of place in terms of light dark and kind of long bouts of darkness, long bouts of lightness. And we do see, not surprising, that both of these extremes seem to correlate with less positive psychological functioning. So I think there is something there that if we can kind of strive for 8-ish hours of darkness and 13 hours of light, that's probably optimal and creates the least amount of stress on our system. So I think ideally, you kind of just try to stay inside that schedule, with an hour left or right across the entire year.
Across the year. So this is okay. So the other thing with Estonia, I was talking to some of the locals because I couldn't believe that sun was up so early and went to bed.
Yeah.
They were saying that in the wintertime, it's actually the opposite. So
Right.
the sun will rise at about 11 and it sort of sets at about 3:30 or 4. So
Yeah.
does it sort of even out over the course of a year, or this is something that we want to try to be achieving on a daily basis? Like the cycle is more of a daily diurnal, 7 or 8 hours, as you're saying, or does it sort of even out over the course of a year?
I think it's diurnal, and we want to try to, yeah, maintain some sort of consistency across the year.
Okay. What about, okay, so same question for shift workers. And
Hmm.
then I have a
Hmm.
question about chronotypes. So shift workers are, the nurses that are working 3 days on, 2 days off, where their circadian rhythms, let's say, are potentially
Hmm.
complete. And we know that, we love our nurses, we love our shift
Oh,
workers, but they have the poorest health outcomes, right? I
I
mean, I think
know.
that
I
I
know.
think shift work has been identified as a carcinogen and, all cause
Yes.
mortality. So talk to us about what are some strategies that someone who doesn't have regular sleep wake cycles, like a nurse, let's say, what can they be doing, if anything, to sort of optimize their light bolus or their light exposure?
Yeah, I think establishing some sort of like consistent, regular routine around these cues that we know are going to impact the circadian rhythm. So, you know, ideally eating a bulk of your calories during the biological day. So that means if you're waking up from your kind of sleep maybe at 3 p.m., you want to try to get in a bulk of your calories from 3 p.m. to, let's say, 7 p.m. once the sun goes down. And then, during your night shift, just trying to, really clean, lots of protein, just trying to not put too much stress on your system during what would be your biological night. So while you can't get away from having to be up during the night, you can pull the food lever to try to at least stay within the bounds of what your body is expecting during that time. So I think if you think about that, okay, what's the big principle here? It's try to do what you normally would do during the day and apply a lot of that to the night, if that may, or keep what you do during the day as often as possible. So food, exercise would be another one. You want to try to fit that in, during, after you wake up, for example. For some folks, even before their shift, as their shift ends, that could be a good time.
Oh, that's a
Um,
good idea. Yeah, yeah, because they're going to be
yeah,
ending at like 6 or 7 in the morning, something like that.
yeah,
Yeah.
and they can work out. It's tough though, because you want to try to. It just depends on the human, right, and what their circumstances are. I think exercise, getting in your exercise at any time is probably is good. We know that is just such a powerful longevity for a powerful lever for longevity. And I think when we, even if it's kind of at a what we'd consider a suboptimal time, it's better than not doing exercise. So figuring out, obviously, exercise when those constraints is really important. But I think food is probably one of the biggest levers to offset any regular sleep wake time. Um,
So trying to
and then
bookend the food, like to sort of line up either with like dinner, let's say if it's the beginning of your
or
shift, or
breakfast.
breakfast
Hmm.
if it's at the end of your shift. Okay, cool.
Yeah, but I think like eating, all throughout the night is one of the worst things that you can do, and probably one of the main reasons metabolic dysfunction is so high with shift workers is because they're eating big old meals when their body's literally just not primed to metabolize food. Like we're just not set up to digest food at night. We're just not, and as a result, it puts huge amounts of stress on our body.
So they should basically be paid more, is what you're saying,
Oh, like
for
a
the
trillion more.
sacrifice.
Like
Yeah,
it is such, yeah. Like I just like these humans. Yeah, we're analyzing data we did a study with UCSF and Las Palmas in Texas, frontline healthcare clinicians, like 370 folks. And we were trying to really test like a coaching platform around these kind of these principles of circadian alignment. So really thinking more intentionally about light, um, you know, minimizing light in the lead up to bed, and then getting a balls of light once they wake up, just to try to, yeah. And it's when I just look at the data, like just their baseline relative to age match cohorts, it's it's just like my heart like breaks,
yeah.
honestly. Like these folks cannot, yeah, they're just like heroes, truly, like in every sense of the word.
So I've had Dr. Michael Bruce on the show a couple times,
Mm-hmm.
very well known for his work on
Mm.
chronotypes. And
Yeah.
I forget all the animals, Michael, I'm sorry. It's like lion, bear. I think there's a dolphin in there. there's,
Mm.
there's another one. So my question is, so chronotypes, my understanding of chronotypes is it's not that, or a night, and maybe a night owl, is that you're not completely switched, but these are just variances of by a few hours, right? So oh goodness, I'm so sorry, Dr. Bruce. I forget what my
It's
name
like
is, but I'm the one
are
that
you a
likes to get
dolphin?
up early. I'm the one that likes to get up early. I like to get
Okay.
up
All right.
early, and then I like to be in bed early. So like I turn into a pumpkin. I like to joke like I turn into a pumpkin about 8:30. I need to be like starting my routine at like 8 p.m. and
Yeah.
9 o'clock. I really want to be in bed by 9. But there's others who really do, like, a lot of creatives. We know that
Hmm.
they often, like artists and things of that nature, like
Hmm.
to actually, they're most creative in the evening.
Hmm.
Uh,
Prefer. Yeah. They have a preference
they
for
have a
just
they have a
evening work.
preference. Yeah.
Hmm.
And my question around chronotypes is more, maybe it's more around my own family dynamics, like aka asking for a friend. So we were talking in the pre-chat. I have an almost teenager. I guess he's a tween. He's almost 13, and I have an 11-year-old. And so what I'm
Mm.
noticing with my 13-year-old is that he is now, his penchant for staying up later, his appetite for staying up later is increasing. And just
Same with my
understand,
son.
same with
Hmm.
your son. Okay.
Hmm.
So what we do know in sort of the teenage years, there does seem to be this like phasic shift in terms of
Hmm.
how, what our chronotypes are. What are some of the things that, well, my question is this unavoidable? Is this just
Mm.
something that they have to do as part of their development that we don't,
Mhm.
maybe understand the reason why, or maybe we do and you can explain that? And then how, for someone like myself who likes to get up early, that obviously means getting to bed early. How do, let's say, the moms and the dads who have sort of different chronotypes from their
Mhm.
family members, how do we sort of navigate that? And then I'll ask you some questions on metabolism in a moment. But I
Mhm.
want to talk about chronotypes, and maybe you can speak on your own personal experience, or what you've seen from the data. Do we have any data in terms of, is this preventable? Like, can we just get our teenagers like to not go to bed at midnight? Is that a possibility, or am I just wishful thinking?
Yeah, I mean, it's definitely light is huge, right? So, for I think what's okay, so I really prescribe to Ken Wright's, I think, work. Dr. Ken Wright, he's a circadian physiologist and has done a lot of this work around chronotypes. And he has some interesting studies where, he throws a bunch of healthy adults. So these are folks that don't have sleep disorders or, circadian disorders or anything like that. Kind of throws them on a mountain, and basically, within a few days, they're all falling asleep within 30 minutes of one another. Okay, so there's no artificial light, right? So they're just on a mountain,
Hmm.
kind of camping. So there seems, and when you look at like a lot of the hunter gatherer kind of research and data, it's, everyone's kind of falling asleep within a half an hour of one another. So I'm not sure that I really ascribe to this like this wild, discrepancy between humans in terms of, I think a lot of it is kind of preference that you develop over time and habit. And I mean, one thing that we do know is night owls die sooner, because I think you're going outside of the bounds of what your body wants to do, and you're kind of overriding those endogenous preferences, and kind of making choices that, to stay up later. And we know this of shift workers as well, like all of the data that exists around, just some of the health, the deteriorations in health that happen cardiovascularly and metabolically, when folks are, up during the night, during the biological night, and just kind of sleeping during the day. So, um, and I think the other piece of research I think that's really compelling is, we know that if you're viewing light between artificial light between the hours of 11 p.m. and 4 a.m., it has a pro-depressive effect in that it will negatively impact your dopamine system next day, your motivation, your reward system. Like it will not function as it should. So I think those are a couple examples of that, okay, if we can abstract from that 11 p.m. to 4 a.m. result, in that beautiful study on mood circuitry and mood and brain circuitry, we know that probably after 11 p.m., there's something negative happening. So I think even for children, 11:30 is probably not the time. I would say for teenagers, probably, the 10:30 range is probably optimal, which is a little later than what it would be for, I think, for adults. So all that to say, I think that these chronotypes are not as wildly kind of our variable, our sleep wake time desires are not endogenous preferences are not wildly different. And that there are some real deleterious effects that happen after 11 p.m. So we know that it's got to be somewhere before that.
Yeah, and I've heard Andrew Huberman talk about this as well, like this 10 p.m. or 11 p.m. to 4 a.m. If you have this, if you wake up and you even just the moment that you check your phone, you just look at the phone and just that blue light, because it's so close to your eyes, is going to have sort of deleterious effects, as you said, on the dopaminergic, serotonin, and melatonin release, and it'll also preclude you from just falling back to sleep. Sometimes you just wake up, you just come out of the sleep cycle, and I've noticed I'm awake. All right. And I'll just close my eyes and go right back to sleep. But if I were to get up or look at the clock or look at my phone, which isn't in my bedroom anyway, but let's pretend that it was, that's just going to be, the outcomes of that are just going to be far worse than just
it creates this like vicious cycle too. It's like, I think to your point, like it fragments your sleep. I think even like when we're pushing past our pressure for sleep, and let's say we fall asleep at 1 a.m., we've been up watching Netflix or or doing something creative and wonderful, falling asleep at 1 a.m. The potential for a more fragmented sleep experience is higher, right? Because we've got all of that cortisol kind of flooding, our system. Our baseline kind of heart rate is going to be revving a little higher. As a result, you're not dropping into these deeper stages of sleep. You might be so sleep deprived that you're getting some sort of rebound, deeper sleep. But again, like that's going to impact your architecture tomorrow and then the next day. So it just, like I said, you end up in this kind of vicious cycle where you're really not getting healthy sleep.
Yeah, I remember it was Matt Walker's book, I think, or maybe I heard him somewhere say this. He said, midnight is middle of the night. And I was like, well, that's really simple and so obvious. Like and it should be the middle of your sleep cycle. And I remember my grandmother, bless her, I miss her so much, but she used to say things like, an hour before how did she say it? It was an hour before midnight is equivalent to 2 after, something like that. I'm messing it up, but it was like the 1 hour of sleep that you get prior to midnight is equivalent to 2 afterwards.
And
I think she wasn't, right. Quite right in terms of like, deep sleep and REM sleep. Like she wasn't, she's a Lebanese immigrant, but she would always talk, but that was sort of her wisdom. It was like, get more sleep before midnight than you get after. And I was like, And she would clean the house with vinegar. She would do all these things. She would moisturize her skin with olive oil. And I was like,
she's ahead of her time.
This woman was onto something. Yeah,
absolutely.
All right, let's talk about some of the metabolic implications of, I know we've been talking about light and, let's talk about some of the metabolic implications of poor sleep, because I think that this is, I know for myself, when I have not slept well, my emotional regulation, I'm just calling myself out here, my proclivity for snapping, or like people to annoy me with things that would never annoy me is much higher. I probably crave more crap. Like I probably just, I'm thinking about chocolate maybe more than I should, or, just thinking about if there's food in the house that shouldn't be there, I'm probably going to sort of be circling it, like a shark, for more so than I would otherwise. Like my inhibitory, sort of my prefrontal cortex, it just feels like it's offline. Like I just can't inhibit some of these sort of primal desires for sweet and, and my emotional regulation. Talk to us a little bit about maybe some of the changes in fuel partitioning that might happen when we are sleep deprived.
Yeah. So there's a lot there. So basically when we are depriving ourselves of sleep, our hormones, ghrelin and leptin, are not going to function as they should. And this is why you kind of feel, when you're sleep deprived, you're going to feel hunger more. You're going to feel like you're going to crave more carbohydrate rich foods. And a lot of that is because
And it's not the sweet potatoes. It's not like the complex carbs.
I know.
It's always the Kit Kat. You know?
I know, exactly. It's like the gummy bears and and the Dorito chips and stuff like that. And that's just because your ghrelin and leptin, hormones aren't functioning as they normally would. So your satiety cues that are driven by leptin are kind of not they're basically the cues that they normally would take are not there. And it's essentially your body, when it's sleep deprived, it doesn't feel safe. As a result, these hormones kind of act in wonky ways to try to create safety, right? And if you think about emotional eating, that is you're trying to kind of create a safe environment, right? And obviously that's maladaptive and not healthy, generally speaking. But that's actually what's happening. There is this something biological going on in those moments that are kind of driving you toward these foods that will make you feel kind of more safe. But obviously over time, if we continue with that pattern, that's when it can become really unhealthy and in real metabolic dysfunction that, what we know as diabetes. And you're also more, when you're sleep deprived, you're more insulin resistant. So this, again, your blood sugar is going to be a little wonky. So you're trying to kind of balance that out with the food intake, and that's where you can get these really big fluctuations in blood sugar over the course of the day that obviously have their negative repercussions. And I would say, just as it relates to kind of circadian rhythms, your glucose tolerance is going to be higher earlier in the day. So generally speaking, I think for women in particular, you want to make sure that we're having, lots of good protein early in the day, and that we're eating a bulk of our calories kind of earlier in the day, as opposed to kind of waiting until the night. And we could talk about kind of time restricted eating and fasting too, if you'd like, but
I would love to. Yeah.
I think that's really important for folks to recognize that, there is definitely this kind of circadian rhythm with metabolism that when we are aligned, we really help ourselves in terms of body composition and, just weight loss and energy levels. I mean, you talk a lot about energy management and fatigue management, eating food and thinking about our circadian rhythms and kind of when we should be taking in food is really important.
I'm so happy you brought that up, because this is where I've probably changed my view on fasting. I've almost done a 180. So when fasting was sort of, I think it still is a premier topic in healthcare. I think it's still very widely discussed. But when it first came out, I was really practicing fasting like a man, because there was no models for women. It's like women
Same.
are, so I would look at some of the sort of fat people in the fasting world, and I was like, all right, I'm gonna just delay my breakfast. I'm gonna increase that 15 minutes every week, and then I'm gonna work up to not eating until 12 o'clock. And then I would have sort of a feeding window of, let's say, 12 to 7 or 12 to 8 o'clock at night. And I am someone who typically works out in the morning. Just, I know that that's not necessarily the best time to work out for strength training, but it's the time that I have. So I will usually give myself some, nitrogen, like I'll, have some whey or something, like some kind of protein, let's say, around that time. And I found it very difficult to not have food to fuel my workouts. I found that my workouts were, my performance was being impacted. My recovery was being impacted. I was much sore for much longer, and I was miserable. I was so like, let's just call it what it is. I was hangry. I was so hungry. So I started thinking about this circadian, because women, I think a lot about cycles in general for women and how we live, we have a fertile cycle, we have cycles of creativity, we have, the seasons are cycles, yearly, all these different things. And I started thinking a lot about this sort of diurnal or the circadian rhythm. And to your point, you just said this so beautifully around being more insulin sensitive in the morning. I was like, all right, let me just play with this let me just try to eat, earlier in the morning, or just in the peri-exercise area of my life, which is the morning, and then cut off the food a little bit later on in the day, which, and the science suggests, and we've talked about it already, that that's going to also help our sleep outcomes.
Mhm.
And I'm so much happier.
I
I'm,
know.
I'm so much like shocker. And then of course, my performance, my recovery, all of these, my
Mhm.
strength, my ability to focus in the gym when I want to, when I really want to punch out like a great workout is awesome
Yeah.
when I've eaten.
Yeah. Well,
And
your workouts, let me just say your workouts are so inspiring. Like I love like following you on Instagram. I'm just like, yes, like I just like you're so strong and you're
thank you.
so like you just wonderfully fit. And
Thank
yeah, it's
you.
just like super inspiring. So thank you for sharing all of your wisdom
Oh,
and your
thank you.
workouts.
Show my
Yeah,
work. I got to show my work. Yeah.
yeah, that's
But but
right.
but I feel like that's really important for women to know because I think a lot
Yeah,
of times when there are new and I would fast like a guy. It would be like the 12
I
to
know.
8 or
I
no, I
was
do
the
the
same, Stephanie. I did the
yeah.
same thing. Yeah, for a
And
long
even
time.
just the long fasts, like that's something I don't really do anymore either. I
Hmm.
was like strong like bull. Like I'm going to go for
Yeah,
like 3
10 days.
days.
Yeah,
Yeah,
I know.
yeah, I'm going to 3 days. I'm going to do a 96-hour fast. And
I know.
I remember thinking we were moving homes and I was in the middle of a 5-day fast and I'm like,
Oh,
what am I
I
doing? I
know.
am lifting boxes. I am exhausted. If you want to think
Yeah,
about stressor upon stressor, like moving, one of the
yeah.
biggest stressors in life, and then not eating. So I've actually moved my entire sort of, we'll call it eating window
Mm,
to heavy load it in the morning.
mhm.
So I've had
Yeah.
most of my calories by about 2 or 3 o'clock, and I
Mhm.
feel great that way.
Yeah. And there's a lot of great research, looking at folks, late eaters versus early eaters, and early eaters by far have better outcomes in terms of body composition and metabolic outcomes. So, improvements in insulin sensitivity, even reversal of prediabetes. So, timing really, really matters. And I think it's important for folks to know that time restricted eating has like a circadian component, whereas intermittent fasting is kind of about caloric restriction, and that's
Yeah.
really not what we're not talking about that here. Really, we're really talking about eating in line with circadian rhythms, which is essentially eating while the sun is up. And I think for women in particular, biasing a bulk of the calories, earlier in the day seems to really, based on the literature, seems to really be the best way to manage your weight and most importantly, manage your metabolic health. So yeah, so I think what you're doing is amazing. And I think for folks who are, are still menstruating, really understanding that, hey, during that, after ovulation and kind of in this 2 weeks leading up to menses, that is really not the time to fast. Like your body is already under, we've got estrogen and progesterone at its highest, right? There's like a lot of things happening in your body to kind of prepare for menses, or if you're pregnant to, be able to carry a child. So either way, that time frame is really metabolically expensive. So if we're layering more stress on top of that, that can have a lot of negative, that can impact you negatively, in that it might delay your period, might make your period come early, and then just the impact on your mood, as well. So picking your times for if you're doing more traditional fasting, you want to probably do it in the back end of menses or during ovulation even. But yeah, I'm so happy that there's like starting, more literature beginning to emerge, and a little bit more science and thoughtfulness around just women and what it really means to kind of restrict calories, and when that might be good and when it might be have a more negative, more harm than good.
Yeah, and I'm so happy to hear that. I mean, I talked about the exact same concepts in my book around fasting in the follicular phase of the first 2 weeks, let's say.
Mm-hmm.
And if you pay
Yep.
attention, your appetite cues are actually, you're less hungry generally around. I don't like fasting right around ovulation because we don't want to prevent it, especially if we're trying to
Right.
optimize for fertility. But you said,
Yes.
sort of that late bleed week, like late into
Mm-hmm.
week one, sort of early into week two, let's say, very good
Yep.
times for fast. We're just a bit more resilient for caloric restriction during that
Yep.
time. And
Yep.
agreed, there's just a lot of, there's a lot of there's a lot of stuff happening in the luteal phase. We're just,
Mm-hmm.
the way that I sort of describe it to my listeners is that you're building an organ. Like there's a lot going on. You need substrate, like,
Yes.
we
So
need,
perfectly
amino
said.
acids, we need free
Yeah.
fatty acids, we need glucose. Your
Right.
body's already preferentially throwing those substrates
Mm-hmm.
into the endometrial lining anyway, along with things like, macro minerals, micro minerals, et
Mm-hmm.
cetera. So it's not really the time to restrict your food.
Right.
I don't like uh, any type of fasting
Hmm.
other than sort of, the fasting that happens while you naturally sleep,
Hmm. Yep.
in that luteal phase, really. So I'm
Yeah.
happy we're aligned on that. And I love what you said about, I just wrote this down, when we're sleep deprived, that our body
Mm.
doesn't feel safe. I thought that was
Mm.
I know that it's such a powerful way to think about it, that you're eating to soothe. You're eating in a
Mm.
way to soothe, and that, you mentioned like emotional eating. That's what it is. It's like it's a
Yeah.
self-soothing technique, which, when not applied properly, that can
Hmm.
have these devastating
Yeah.
consequences. So my question to you is, okay, so if let's talk about the 80-20 rule. So 80% of the time we're doing things right. We are going to bed at the same
Hmm.
time. We're waking at the same time. What if we know that there's going to be a big event? We have
Hmm.
a wedding coming up, or there's a big,
Yep.
you're going to be in a different time zone, something like that. What are some things that we might think about leading up to the big event? Because it's
Hmm.
probably, if it's a big event, it's probably going to be in our calendars. We know what day it is. We know when our
Hmm.
flights are, all the things. What are some things that we can prophylactically think about as a
Hmm.
way to negate some of the negative consequences that can happen from a poor night's sleep, and
Hmm.
probably, well, maybe this will lead us
Like
into an
alcohol or
alcohol.
yeah.
Yeah, like
Hmm.
there's going to be
Hmm.
alcohol, there's going to be time zone changes, there's going to be
Hmm.
interruptions in your exercise routine. What are some things that we might think about for, these one-off big events?
I love this question so much because I work with, folks who are in a lot of my research is in these high stakes, high stress environments where they're going off, to Afghanistan for a mission. And what does that lead up into that mission look like? Or they're going into, where they're going to be, on call for, you know, 3 days. What does it look like in the lead up to that? Or, we've got professional athletes who are going into, to the Olympics and are traveling. Like, what does the lead up look like? So, these big events, it's really about doing as much as you can, as consistently as you can in the lead up to that event. So it's not surprising. So what you don't want to do is go into that kind of more irregular, erratic kind of schedule under recovered. Like that is what is really crushing, right? So if you can kind of go in as like healthy and firing on all cylinders, you're going to be able to override like any of the negative effects of just 2 days of like really letting it all hang out. So I think like thinking, in the levers, you kind of, touched them, like trying to be really regular. I mean, I think it all comes back to trying to minimize circadian disruption, right? Like we want to try to create as much circadian alignment as possible. So that's eating while the sun is up, biasing a bulk of our calories earlier in the day, finishing our last calorie a couple hours to 3 hours before we intend to sleep. It's called time restricted eating, really important. Stabilizing when we go to bed and when we wake up, doing that as often as we can, getting a lot of water, really trying to minimize alcohol intake, putting nourishing, nutrient dense, food in our body, really important, meeting our sleep need. These are just like kind of the basic stuff, and I would say, working out, getting exercise daily, movement, really, really important. Trying to, pay attention to that sedentary behavior and not let that, creep into the hours and hours over the course of the day. So it's just like a lot of the typical things, but going to this event, you just want to make sure that you're as robust as possible so you can, to your point, kind of mitigate the negative effects of this disruption.
And would you change, so would you change the sleep, like let's assume that the time, would you change the sleep patterning leading up to it? Would that be the same, or would you try to get more sleep than you normally would, or?
Yeah, so sleep extension can be helpful leading into events where you are going to be sleep deprived. So there's no question. A lot of folks though can't sleep longer, right? Because they've got these pronounced circadian rhythms, right? And they're used to getting up. So I would say if you can extend your sleep by maybe 30 minutes on either end, that would be the most I would really do. The other way to kind of help with potential like sleep disruption is maybe getting in like a nap, after lunch for 30 minutes, no more than 30 minutes. That could be another way just to kind of, just reduce some of that stress accumulation throughout the day. And again, just kind of protect you a little bit from maybe shorter sleep in the future. Um, I would say if you're only going for like 48 hours, um, I would just on the I would basically just try to get as much kind of sleep going into that. And then once you land, just kind of do whatever is happening on that time zone. If you are going to be staying for more than 48 hours, I would try to subtly shift your circadian rhythm so you can assimilate to that new time zone. So that would mean all the levers that we've been talking about, you just want to kind of subtly shift them, kind of incrementally in the lead up to your departure. So you're more shifted toward whatever time zone you're going into. And then when you're on the plane, I would, eat in that time zone, view light in that time zone, restrict light based on that time zone. And then once you land, do everything in that time zone. So if you land at 7 a.m., like get lots of light, eat breakfast, like just really like, all right, new time zone. And then if you do feel really, really sleepy, make sure it's no more than 30 minutes. Like you want to fall asleep when everyone in that time zone is falling asleep. So you have to really build that sleep pressure so you can fall asleep.
Do you know, it's a very silly trick. I'm sure that there's no data behind it, but it works really well for me. It's just changing my clock on my watch. So if I know,
Oh,
let's say if I'm going to Europe, let's say, and I know that
mm-hmm.
it's like 6 hours ahead, 7 hours, whatever time, I
Yep.
changed on my watch. So I'm like, oh, it's already 7 p.m. there. Okay. So like I
Mm-hmm.
got to get in my dinner, even though it's like 2 o'clock here
Yep.
or, 1 o'clock.
100%.
And then when we're
Yeah.
on the plane, I'm like, oh my God, it's 12 o'clock at night. I got to get to bed, So I just
100%.
start thinking about it in that time zone. And it's
Mm-hmm.
a silly little thing, but it works so well for me. And when I don't change the time on my watch, I can't seem to
Mm-hmm.
think in that new time zone. Like it's just
Yeah.
that extra calculation in my head. So
I love that. Yeah,
I don't
that's
know if
an
that's
awesome
useful.
hack. Oh, for sure. Like, and that's the whole, yeah, you just want to try to do, again, if your goal is to kind of really assimilate to the new time zone, you want to start to adopt those behaviors. That said, you don't want to kind of, you still want to be able to kind of, uh, unless you can really, black out your curtains, eye mask, and like sleep during like what you would be sleeping, like in that normal time zone. If you can't do that, it's better just to kind of stay in your own routine. Again, be as robust kind of going into that travel as you can, and then just kind of adapt on the fly, um, you know, once you get there.
Let's talk a little bit about alcohol because there's going to
Mm.
be, just piggybacking on you're going to have a big night out. You don't even need to change time zones. It could be, I got married this last summer and I had one glass of champagne because I thought it was momentous enough to justify, and I didn't even finish it. I had a couple sips because I don't really like alcohol. But let's talk about, I thought I should probably have some champagne on my wedding. Let's talk about let's talk about, especially when you're doing cheers, like you're going to just look like the crazy person that's like, no, I'm not drinking this poison. Let's talk about alcohol and its effects on, I'd like to talk about sleep because
Mm-hmm.
I have sort of come out with a little bit of blowback. Maybe I'm a bit of a hard ass, and you can certainly redirect me if I'm being too hard here. I don't actually see any justification for alcohol. It's very
Mm.
difficult. Maybe a wedding, birth of a, if there's a birth of a grandson or something, I don't know.
Yeah.
Uh, I don't actually see any justification for regular consumption of
Mm-hmm.
alcohol. And I remember a few years back, I think it was David Sinclair's lab had published something, and sort of the media took it and ran with this idea that red wine has all of these sort of heart enhancing
Yeah.
benefits,
It's
but it's
terrible.
like,
Yeah.
yes, resveratrol. And
Yeah.
so the amount of wine you would need to consume
Yeah. It's
in
like
order,
4 bottles of wine or something. I mean, it's just insanity.
it's like
Like,
you're going to
yeah.
kill yourself.
Yeah.
You are not going to you are going to get fatty alcohol liver disease. So let's talk a little bit about alcohol,
Mm.
because typically when alcohol is consumed, again, coming back to the circadian
Mm-hmm.
biology,
Yeah.
hopefully it's not being consumed in the morning. It's most typically being consumed in the later hours of the day. It's a nightcap with your husband, or it's dinner with friends,
Mm.
let's say. And so you're usually consuming it after dinner or with dinner, let's say. And that's very close to bedtime. That's
Mm.
maybe 3 hours from bedtime.
Yeah.
How does that affect our sleep? And then I'd like to also understand sort of what's happening, if you can speak to sort of what's happening metabolically, because we know that the liver is
Mm.
going to sort of prioritize metabolism of the alcohol over any of its other many processes that it oversees.
Yeah. I mean, just I have the benefit of seeing like just huge amounts of data, right? And there is no question that the one single behavior that is most crushing to sleep and most crushing to markers of recovery is alcohol consumption. And the closer alcohol consumption gets to bed, the more deleterious effect it has on your sleep and your recovery. And I think what some folks will say, oh, I get into deeper stages of sleep, but your sleep becomes so fragmented that the quality of your sleep is totally compromised and you essentially don't get any REM. So while it might make you feel like you're getting into deeper sleep, being unconscious and actually experiencing quality sleep are two totally different things.
It's
So
not
it
real sleep. It's not true sleep.
no,
Yeah.
no, 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 it isn't. So to your point, like all the restorative and regenerative effects that happen during sleep, are compromised when you have alcohol in your system, because alcohol will get prioritized. Like your body has to deal with the alcohol in your system. As a result, all of the regenerative kind of functions that are happening during sleep, physically and cognitively, during slow wave sleep and REM, literally aren't happening, right? Because your body is having to process and digest alcohol. And that's why we see such high heart rate during sleep and low heart rate variability. And this is just, you're in a sympathetic state, which again is the state where you're not actually restoring. And yeah, and as a result, like you're not helping your recovery next day. And when you don't sleep, you're not releasing human growth hormone, which is be protective from mental illness and injury. And you are not getting the requisite REM sleep, so your executive function and mental control next day are going to be compromised. So it has, like, just, I think, to your point, like, there is no literature that suggests a moderate amount of alcohol is in any way, putting deposit in your bank account. Like, that is not happening.
It's definitely a withdrawal for sure. Yeah.
It is a withdrawal. Yeah. And I think, like, and it's just weighing the cost and the benefit, right? Like if you're doing it a couple times a month, yeah, like that's not a big deal. Right. But yeah, I mean, if you're having a few drinks a week, like that is going to compound and have a negative effect. And it's going to impact, your sleep mostly. But then there's all sorts of other things happening in terms of just diversion of resources, having to deal with the diet, the metabolizing alcohol is just so costly on the system.
What I heard, I was surprised when I was researching in preparation for our conversation. I was listening to your conversation on the Whoop podcast, and I'll find the episode and I'll link it in the show notes. But you were citing a study around consuming alcohol even 6 hours before sleep, and that having a negative impact. Like we sort of started off
Yeah.
this conversation saying, oh, it's like 2 or 3 hours before dinner. And you might say, well, it's probably going to take about an hour or two to sort of metabolize the alcohol. But in this particular podcast you were citing, and I don't know if you remember it or not, but
Mhm.
or if you can speak to this, but 6 hours before going to bed, like alcohol consumption will still have sort of a blast radius. It'll still have this negative impact on your sleep, which I found that fascinating, that it was such a
Yeah.
large timeline. I wasn't aware of that large of a delta prior to
Yeah.
hearing you say that. Yeah.
What's really fascinating, and yeah, and there's lots of good literature, but what's really interesting, I look at, if I have like one glass of Prosecco, it takes, and we have this like real time heart rate and heart rate variability data, and it comes through in our stress monitor. And it basically is an algorithm that's looking at heart rate and heart rate variability continuously and maps it on a scale of 0 to 3. So you can kind of see like where your stress is throughout the day and just give you insight into kind of what might be causing stress. Well, when I have alcohol, my baseline stress is like 1.7-ish generally. When I have alcohol, I'm almost at a 3,
With one glass of
which is the
Prosecco.
one glass of Prosecco. And it takes 4 hours to get back below 2. 4 hours. So like if I go to bed with that one glass of Prosecco, like I'm hovering in a 3. Like I can't even drop into REM or slow wave sleep.
That's
So it's
crazy.
just like that, the liver basically, it can't, that detoxification process is just so expensive that it's like all these processes like just can't happen simultaneously. So I think that's why, yeah, alcohol is like just really crushing. Just like one glass of Prosecco takes 4 hours to clear my body. Imagine if I'm having, a couple drinks an hour,
And you do that 2 or 3 times a week for 10,
two or 3 times a week.
10, 20 years. Yeah.
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 So it's like you basically go throughout the day where we're supposed to be alert, we're supposed to be stressed, sympathetic activations, like pretty normal, right? And then we have 2 drinks before we go to bed. Now all of a sudden, like body's like, oh shit, okay, here we go, and I'm like just revving at this rate where yeah, like it just like your body can't do anything else. It's just the reality of it.
So let's sort of pan this out a little bit. You've had some alcohol. Maybe you're someone who has a nightcap with you're trying to take the edge off of whatever stressful day you've had. And we've demonstrably been able to show in this discussion and the research that you've been able to accumulate that it's not actual sleep. It's very fragmented, to your
Mhm.
point. You don't have the REM sleep that you should be. So you would be, in theory, and not just theory, but in reality, you're racking up sleep debt, right? So you are
Yes.
racking up lack of sleep that you should be having. Is
Mhm.
there is there a way in that, can somebody make up that debt that they are incurring, or
Yeah.
is it just something that sort of gets washed out with time? Like how
Mm.
can we rectify that?
Yeah. I mean, you can't really make up for lost biological sleep, right? So all the genes that are supposed to be turning on and turning off, like, that all that doesn't happen, right? If you've got alcohol in your system. So we can't ever make that up, right? That sleep is lost essentially. And I what we see in our research is that, if you are not getting the sleep that you need, right, and you're accumulating what we call kind of sleep debt for every 45 minutes of sleep debt that you get, that basically results in a 10% decline in next day executive function. So you're 10% dumber with every 45 minutes of sleep debt you accrue.
Good grief.
So yeah, so it
10%?
doesn't, 10%. So this is measured via MBAC and Stroop. So this is a year-long study that we did with McKinsey CEOs. Yeah, it is wild, and we haven't published it yet, but we've talked about the results. But so there's prelim data, but
That's
absolutely
wild.
fascinating,
That
right?
is
It's wild,
wild.
right? I know, and I think what's like so sneaky is like we can't actually perceive our own cognitive, physical, and emotional declines generally, right? Like, and the other study that's wild is that we looked at sleep debt in these, really hard charging CEOs, and we had all of their direct reports were basically filling out a survey daily on how psychologically safe they felt. So there's like, Dr. Amy Edmondson, a renowned researcher from Harvard, who is like the godmother of psychological safety. And we know that psychological safety correlates with, more revenue generated. When you feel psychologically safe, you can kind of bring your true self to the table. And that's where people feel, the happiest and the healthiest. And what we saw is
Creative.
that
Yeah. Hmm.
creative and yeah, and just yeah. So what we saw is that for every 45 minutes of sleep debt that these CEOs accrued, their direct reports felt less psychologically safe. And their
Employees.
employees, their employees.
Wow.
So imagine, take that same kind of theory and bring it into your home environment. Like what if and as CEOs, they're trying to keep it together, right? Like they have this sleep debt, but they're trying to be as great as they can for their direct reports. But what happens when I go home is just like, imagine your household not feeling psychologically safe around you because you're carrying sleep debt. So that alcohol that you're having at night is creating this sleep debt invariably, which is like, isn't just impacting you, to be very clear, right? Like that sleep debt that you accrue is going to impact every single person you love and care about. Like you will be less patient. Just how you hold, like, and even if the CEO isn't, is really doing everything they can, they're like, all right, I know I'm tired, but I'm going to just do my best to kind of put my best face forward. Like how their direct reports are perceiving, just even how they hold their face, right? Like I can't perceive my own declines, right? Come back to my original point. Like, as a result, like I can't control like how I'm emoting. I can't control, like I can't even perceive that these like kind of negative emotions are getting transferred to the people around me.
There's these
That's
nonverbal cues that they're
yeah.
picking up on.
It's
Yeah.
like it's just is so kind of scary to me, but also like this unbelievable opportunity for leaders or anyone who's in charge of anyone, whether that's a parent, like I don't care who you are, you're interacting with people. I don't care if it's like the, you know, the cash register person at CVS, like I don't know, she doesn't deserve it. Like my sleep debt baggage, right? So I don't know. I just feel like it's like this responsibility we kind of have as human beings to like, yeah, just like get it together.
I think that that is so powerful for everyone, you know, and my mind, of course, is on my, as a mother, like, how do I show up when I've
Mm,
had a really bad night to my kids? And what are they making of that? Are they internalizing that and saying, am I, you know, gosh, I'm going to cry now, but like, are they trying to say like, oh my gosh, I'm such a bad kid. Like, that's why mommy's mad at me. Something like that. Right. So it is
yeah.
really worth thinking about protecting our sleep and really taking it seriously. Like, I think that
Mm-hmm.
it's one of those things like, oh yeah, doc, I get it. I should drink more. I
I
should
know.
sleep more. Like, wouldn't it be nice? But yes, it would be nice. And you should do it. And you should try to figure out strategies in your family or in your, you know, in the people that can support you in
Mm,
raising a family where you
mm,
can find sleep. And so, you know, the naps that you said, I think that's really great.
yeah.
I've had discussions with people who talk about taking naps. You know, I've heard up to 90 minutes, no longer. I've heard no more
Mm,
than 20 minutes, but you know, I think
yeah,
there's some, you know, bio individuality there.
for
I
sure.
typically like 10, 15 minutes is like a little
Hmm.
siesta I like to take midday
Yeah.
if I've had a rough, you know, let's say I had a rough night for whatever reason.
Hmm.
Last question. So we'll end off with a banger. In terms of sleep, where do sex and orgasms fall on
Mm,
the sex, sorry, sleep scores? Is it better at night? Is it an afternoon
mm,
delight? Is it, you know,
mm.
sex at dawn? What do we like? Do we, you know, some people will say, you know, good sleep starts in the morning. So is it like, should we have sex in the morning or is it in the evening? Like, what, is there any
Mm,
literature? Do you have literature on
mm.
that? Do you have
Okay.
anything to say on that?
I think you should have sex at both times. So morning and night.
All day long,
um,
actually. Yeah.
yeah, all day long. um, yeah. So I think it's highly individual, right? But we do see sex as a sleep promoting behavior. Of course, it's consensual with a partner. Those are the data that we've been able to look at. And we do see that there are um, folks get into deeper stages of sleep and seem to sleep better when they're having sex with a partner. And basically, how we looked at the
This is
data, we kind of
orgasms or
controlled.
just sex? Is it
This is
orgasm?
just reporting sex, so we don't know if
Okay.
they're actually if they're
Climaxing.
actually
Mhm.
climaxing.
Mhm.
Uh, I'm sure the guys. No, I'm just kidding.
Yes. We've done podcasts on that too. Yeah.
Okay, good. So yeah, so we don't know that piece, but we do know that there is something really powerful about engaging in sex with a partner prior to sleep. When again, we kind of control for alcohol, and it kind of basically looking at it. Is it around their typical bedtime or not? So basically, because a lot of the effects would wash out if they're having sex at 3 a.m., for example. So we basically just kind of try to control some of the confounders and really look at okay, typical bedtime, are they having sex or they're not having sex, and how is that impacting sleep? And we're able to see, in fact, that the sex is a sleep promoting behavior, which is really cool.
And it doesn't matter what time like, so we're controlling for the, you know, the 11 p.m. to 4 a.m. time when like
Exactly.
all that
Yeah. Where you're
activity,
just,
but
yeah.
all through the day, all of those things seem like if it's morning, evening, or afternoon, these are just it's just
Any
sleep promoting behavior.
sex throughout the day, whether it's, morning, midday or evening. So whenever folks are reporting it, seems to have a positive effect on getting into deeper stages of sleep.
Great. That's good to know. And then do we see
Yeah.
a difference? Do we see any sexual dimorphisms there in terms of, because there's different neurochemicals that are released, men and women, right? So we
Hmm.
see, I know there's I mean, both, you know,
Right.
we both release oxytocin, you know, post
Mm.
orgasm anyway. Do we see any sex differences between,
Mm.
in terms of sleep promoting behavior, at least?
So my hypothesis here is that guys probably fall asleep. So their sleep onset latency, so how quickly they fall asleep, is probably uh, uh, faster than women. So, and this is the typical, women like to talk after sex, guys like to sleep after sex, right?
The
So
post-coitus cuddles.
the post, exactly. So,
Yeah.
but that said, we can't actually measure when you intend to fall asleep. So,
Right.
so this is like a tough one for us to be able to kind of vet in the literature or vet in a study. But I want to do that study and at some point, because I'm really curious. But my hypothesis would be, given what we know about uh, oxytocin and just like how men feel sleepy after sex, I would imagine they probably fall asleep faster than women. So yeah, that'd be
Well, I want
like
you
my
to do
only,
that study as well. And I want you to come back on the show and I want you to discuss it because I think that it's so interesting because we
Mm,
do, just with many of the women that I've spoken to, a lot of people,
mm.
like they want to feel safe, right? It's that we've been talking a lot
Yeah,
about safety sort of all through the
yeah. The
conversation is
nervous
that
system and recovery. Yeah.
yeah, like that sort of bonding that you feel,
Hmm.
whether or not, I mean, as you said, like it's a consensual, hopefully it's a
Hmm.
consensual
Of course. Yeah.
relationship and all of those variables have been controlled for. But I think that there's this sex difference between men and women in terms of, especially with sex, is that feeling safe. Like men just sort of,
Hmm.
yeah, they just really become quite flaccid, right? They just go
Yeah.
right to sleep, right? So
Yeah.
it's very interesting to see the differences between men and women there as well. So that
Mm.
would be a very interesting study.
Yeah.
Let me know when that's done, and we'll have you on the show again.
Perfect. Yeah,
Hmm.
it's definitely a I think that sex behavior is definitely changing, with just smartphones in bed and like there's just like
Yeah.
a whole
Hmm.
new dynamic I think that has probably some really interesting effects on our physiology and our psychology and just how we evolve actually as human beings. So
Hmm.
it's a very interesting space, I think.
I feel like our time together has just gone in an instant. We've just
I
racked up
know.
90 minutes together. Just looking
Crazy.
at the time here, I would love to have you. We didn't even get into. I wanted to talk. There was a couple of things I wanted to touch on, so we'll definitely have to come bring you back for part two.
I know,
Um,
training
I
and
know we didn't
just
even
even
get to
some recovery.
training.
I
I
know,
know.
I know, but that's okay.
But this was this was part
Yeah.
one of what will be a two-parter. If people wanted to follow your work, some of the research that you're
Mm,
publishing, I know that you've co-published with, some very
mhm,
prestigious labs and
mm.
your ongoing
Thank
research.
you.
Where can people find you and interact with you and tell them all the places?
Yeah, so I have, my Instagram is like not very mature, or, like I haven't really figured that out entirely. Like I try to post the research. I try to post things that I think people would like and are important. But yeah. So Kristen, I need to look at my handle. Sorry.
It has some numbers on it. I
um,
know that. I'll,
it
I'll make
does.
sure.
It
I'll make
does.
sure that it's in the show notes. It'll be a click.
It's
It's like Kristin
my kid's
Holmes.
birthday. Yeah. Yeah.
Oh, that's
Kristen
so.
underscore Holmes
Yeah.
2126. Yeah.
Uh-huh.
And then LinkedIn is another place where I haven't posted anything in months, but like if something big happens, I definitely post there. But Instagram, probably the stories, like if, we publish something or, like I'll throw it in there and if I have time, I'll do like a post. The stories, the quick one. So yeah, there's I put in a lot of like good nuggets there. I mean, one nugget in there is like actually novel research that is gonna, I think, blow the space away. That I'm super excited about, and it's the relationship between um, it's sleep wake timing. We basically have been able to see like down to the minute we can predict your recovery next day measured by heart rate variability and resting heart rate. So basically,
What?
with
That is
every
incredible.
I know. With every 10 minutes of variation, you'll have a 12% chance of an abnormal HRV. At 30 minutes, the odds increase by 42%. Now, this is in freaking 18 to 23-year-olds, collegiate athletes. That amount of
Wow.
variability is that disruptive. So just imagine a 40-year-old experiencing 30 minutes of disruption. So we're going to run those analysis across every single age bucket. But this is a huge finding to be able to like down to the minute, be able to see like this degradation in heart rate and heart rate variability. But I
Fabulous.
post
Okay.
stuff like that. So
Yes, and all of my
yeah.
so there's like we this is you are in a nerd army unite. You are in the safe nerd space here to talk about all of that stuff, because all of my listeners
Amazing.
will gobble that up. Okay, so I'll make sure that I
Awesome.
find that post as well, and that'll be in the show notes. Kristen, it was such a delight. I will make sure, I cannot wait for us to meet in person, maybe me
I
in Boston,
know.
you in Toronto,
Oh,
or somewhere, some
would love
conference
that.
somewhere. And I definitely want you on for part 2 if you are game for that, because I think we
Of
didn't even get
course.
to exercise. We didn't
I
even get to
know.
cold and hot. We didn't get to, thermal manipulation as well.
Ah! Yeah,
I know.
this is
But
great though.
sleep is such an
This
important
is
topic.
great
It was
foundation.
foundation
Hmm.
for my listeners. Thank you so much for your time and focus. I really, really appreciate it.
It's my pleasure. This is amazing.